Hey, good afternoon. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center, and welcome to Facebook Live this week. Glad you could join us. So, this week at CGH Facebook Live, a couple things we're going to do. We're going to do our usual COVID update and take a little bit of time. I have some visuals, some graphs to show you that I think you'll find helpful to understand where we're at right now with this pandemic here in the United States and in Whiteside County in particular. And then when we get done with that, I have a couple ladies, Laurie Buckman and Julie. I'm not going to try to say her last name. I'm going to ask her when she comes on. And they are involved with our OB patients in terms of taking care of them and also taking care of their mental health. So we're going to have some question and answer with those two ladies once I get done with our COVID update. So with no further ado, let's go with item number one, and that is a COVID update. So first thing I want to do is show you just some numbers in the area, how we're doing there as far as that goes. So this is our county weekly report. And the red line on the top left there, that's the cases this week. And the blue line are the cases the previous week. And then if you see the bottom part of that, the bottom graph there, the red once again are the cases this most recent 2 weeks, and the blue line are the number of cases the past 2 weeks, so like 3 to 4 weeks ago. Our trend is up. You'll see on the right there the positivity rate. It's 1.5%. It's still way better than it was in November, but it's creeping up. And the state number is creeping up too. And like today I got the number of cases that they've reported yesterday were 6. And 6 is the most cases we've had reported here at the hospital for quite a while. I don't even think that includes the county. So definitely, as you've read and you're aware of, we're having a surge related to this Delta variant. And it tends still to be folks who are unvaccinated, although people who are vaccinated still can get sick. They tend not to be hospitalized if they're vaccinated. So that's the advantages of being vaccinated, is that number one, you don't tend to get it. And number two, if you do get it, you don't tend to get quite as sick. So all the more reason to get vaccinated. I'd like to show you another graphic, though, speaking of this whole vaccinated versus unvaccinated situation. And Matt will put that up. There we go. Can you make that bigger, Matt? Oh, great. Thanks. So what you're seeing there is the spread of COVID, and what they do here in this visual is they break it down to the percentage of the population that's been vaccinated, and then the case rate. In other words, the case rate above per 100,000 population. And you can the deep purple, I guess, is the color I would go with. There are the areas in particular where the Delta variant has spread more rapidly, and it tends to be areas where the vaccination rate is below 40%. And you see the case rate goes up there along with that. And we are, and you can see so our county is still not as dark purple as you see in some of those places. Our percentage, last I looked, was around just a little under 43%. So we're above 40%, but not by much. So you get closer to the suburbs and collar counties and bigger cities in Illinois, and you're going to have a higher percentage of fully vaccinated. The state fully vaccinated percentage is about a little over 58%. So if we're 43%, let's say, you could probably assume that collar counties in the city and some of the bigger cities in the state are probably, I don't know, they're above 58% for sure. And I don't know how much more than that. But their risk of having outbreaks from the Delta is going to be less than ours. I want to show you one other graphic that Rebecca Green showed me just before we came on that I thought was really helpful in terms of showing how this Delta variant is spreading. Marianne, yes, there are. There are definitely patients in the hospital with COVID again. I think we went like 6 weeks or so without having patients in here, and now we're starting to have them again. So this goes from sometime in like June 28th up until now, and as it turns red, that's the spread of the Delta variant. As you see more and more cases you start to see that. Yeah, I'm just going to let that play out. And as we're getting closer to today's time, to now, you can see that red is, which is the high rate, is definitely taking off. And you can see Lake Michigan there, and around Lake Michigan, it stays yellow, which is moderate. You get around us though. Yeah, thanks, Matt. You get around us though, and we're kind of in that band that's starting to not look so good. So once again, it kind of goes to our vaccination rates. Take home. Yeah, it's not too late to get vaccinated. If you haven't been vaccinated yet, do it. Get it done. I am, once again, I think I said this last week. I don't know what the number that we're having in our country dying of COVID is right now. I think it's like over 300 again, and moving up. Not as high as it was before, and part of that is because a lot of the really some of the at-risk people, the older folks in our population have tended to be vaccinated, but still, there are every day, let's say, over 300 people dying in our country of COVID. I'm certain there are not over 300 people dying of vaccinations. As a matter of fact, I bet you that number is closer to goose eggs. So the risk of getting vaccinated is way less than the risk of getting sick with COVID or getting someone around you sick with COVID. So I, once again, just encourage folks to please, if you haven't been vaccinated yet, move forward and get it done. Okay, so that's my COVID update. I'll take any other questions that come up during the course of this broadcast. But what I'd like to do now is to bring on Laurie and Julie. So Laurie, I've known you for a while, and Buckman I can handle. Hi, Laurie.
Hi.
Laurie's a nurse midwife in our OBGYN department. So glad to have Laurie with us today. And Julie, how do you say it?
Kirchhoff. So I know it's got CHH, but pretend like it's KIRK.
I would have said Kirchhoff, and I probably will at the end of the broadcast too. But
that's okay. I respond to both.
And Julie is with our Ways to Wellness program, which helps folks who have kind of combined physical and mental health issues at the same time. And so Julie tends to do more work with our OB patients. And so I wanted to have her on today too to talk about that. So today's broadcast is going to be about the work that we're doing with our OB patients in particular, and some mental health issues that they have. So I'm going to start with Laurie and say bye to Julie. Bye, Julie. We'll see you soon. And she's going to mute her mic while Laurie and I do our thing. And so, Laurie, are you ready for a few questions?
Sure.
All right. So can you talk about your journey to becoming a nurse midwife?
Yeah, so my journey in nursing began in, I would say, 1997 was when I began my RN. And I started on a med surg floor and then moved on to OB, and then I fell in love. And I worked as a labor and delivery nurse here at CGH for, approximately 15 years before I decided to go back and get my midwifery. The hospital actually encouraged us. I started with an associate's degree, and after 15 years or so, I got my bachelor's and then just kept going. So that's how that started.
Okay. Yeah. So what does it take? What training do you have to do to become a nurse midwife?
So I was in a master's program through the University of Cincinnati, and my program was based online, as a lot of programs are nowadays. And I did have to have quite a few hours of training with just a midwife. I did some training with our doctors here, but then I moved on, and my last 2 semesters had to be directly with a midwife.
So what is your current role in helping with deliveries as well as prenatal care, Laurie?
So I see OB patients, new OB patients in the clinic side, and have patients that are coming to me just due to they would like a midwife. I do take call rotation with the OB doctors, and there's always a physician that's on call with me when I'm on call, so that if I have an emergency of something that I can't do, such as a cesarean section, they're readily available to help me out. I can't hear you.
I forgot to unmute. So let me start that again. So as far as the GYN side of things, there's OB and GYN. Let's talk a little bit about GYN. What kind of GYN work are you doing there in the clinic?
So I can see patients, women, all variations in their life, starting in their teen years, maybe starting with some contraception and then moving on into their PAP screenings, routine health care. And then if, in the menopause years, we can talk about that. Obviously, my love is in OB, but I do see patients in all stages. So,
yeah, I thought you did some GYN. I know OB is kind of your baby. If no pun intended, but that's kind of your thing, right?
Yes, that's where my love is.
Sure. So let's talk mental health. What, if any, changes in mental health concerns with your OB patients have you seen since the start of COVID?
Yeah, since the start of COVID, the mental health challenges have been increasing, and I felt myself pretty much, it seemed like every visit somebody was having some issues. And I think it was due to the isolation that patients were having, the fear of COVID and being pregnant, the fear of COVID and what's that going to do to my newborn. We did have to restrict and only have one support person available during labor and delivery. That was difficult. It was very difficult for patients who were younger and really, really wanted their moms there with them, and they couldn't have that.
Yeah.
But the overall anxiety we saw increase, and we felt we had a need to increase that help for those patients.
Sure. So let me ask you this too. So for patients who come to you who are already on some type of medicines for mental health, what do you tend to do with those medicines during their pregnancy, Laurie?
So I'll try to encourage, if the medicine is safe, it's much encouraged that they stay on that medication, because it's much better for the pregnancy itself and for the mother to stay stable versus trying to discontinue medication and then kind of spiral downward.
Yeah. How about for patients who begin to have mental health issues during their pregnancy or afterwards?
So, we do screenings throughout the pregnancy, checking to make sure that our patients are doing well. It's a depression screening we have them fill out, or if a patient just, shares with me that they're having anxiety or depression, then I talk to them a little bit about starting some medication, because if they have depression and anxiety during pregnancy, they're at that much higher risk postpartum. So we want to get tabs on that before they deliver. You want your patients and your mothers and babies to bond well, and you want the mothers and the families to enjoy the new baby versus be struggling.
Yeah. So, which kind of leads to, obviously you have Julie in your hip pocket as someone that you can refer folks to. When do you tend to decide, hey, it's time to refer someone to Ways to Wellness with Julie?
So I talk a lot to my patients that I feel that everybody should be able to have somebody that they can talk to. And sometimes it's very hard to talk to your circle, per se, your family, because, there are times where during pregnancy, it's supposed to be a happy time, but sometimes things aren't the way you want them to be. Sometimes people just don't enjoy pregnancy in general, and we don't want to admit that to a lot of people. So you feel very alone.
Yeah.
So having somebody that you can talk to and know that you aren't alone helps that a lot.
Yeah, good. Well, I tell you what, I'm Laurie, I'm gonna now put you on. We'll have you kind of in the background, and I'm gonna pull Julie up here. So hi, Julie. And by the way, thanks, Laurie.
Hello again.
So, and before I go any further with Julie, just for folks who are listening here, part of the Ways to Wellness program, I don't know if part of it or all of it, but I think part of it is supported by our CGH Health Foundation. So I just wanted to make sure that folks understand that part of supporting and giving to the CGH Health Foundation helps to support people like Julie to do the work that they do to help out our moms. So I just wanted to make sure I got that in. So Julie, welcome. Glad to have you with me.
Hello.
So can you talk a little bit about the services that you provide for our OB patients?
Yeah, and just to kind of add on to what you just said too, so with that Ways to Wellness program, this is completely free for patients. So they're referred to see us and they don't have to pay for it, which is really great, which also helps with, financial anxieties and stress too, knowing that they might need help, but they can't afford it. So that's what's great about our program to offer to them.
Thank you. Thank you for adding that.
Yes,
very good point.
Like the big thing.
Yeah, it is.
And I feel another thing that's great about this program is that we do collaborate with providers. So we're not just working with patients for their medical aspect, but it's like the patient as a whole. So we're able to touch on the medical aspect with the providers, but then with the emotional, social, and environmental issues that they might be having. So providers will refer patients to see the Ways to Wellness providers, and we can offer those support services. We can do one-on-one therapy with them. We're going to be starting a support group for these OB patients. So be looking for more details about that. That's hopefully going to be starting in September. But a lot of times these patients don't necessarily know the resources that are available to them within the community. So a lot of this is happening, financial stressors. Patients don't know what's there. And so I can help them find medical insurance, food benefits, and education, transportation, and just different support systems within our own community too.
That sounds wonderful.
Yeah.
That sounds wonderful. So ballpark, how many folks do you work with on a typical, how many folks do you have on your list that you're working with that are OB patients?
Well, so this is a fairly new thing that we're starting. This Ways to Wellness program has been around for 7 years. And Christine Romsberg is who is primarily the one who is seeing patients, but there was more of a need. And then I've been with the team since September of last year. And just recently, within the last month, we've opened up a day primarily just for OB patients. So every Wednesday, I'm located in the OB department.
Oh, wow. Okay.
And I have been, since I've been there, I believe I just had my 3rd or 4th week, I've had a completely full schedule. So first patient being seen, 9 a.m. and last patient being seen at 4:30. So it's a full day of helping people. So the need was there, and I'm glad we're able to provide that.
Yeah, well, that's great. So besides Laurie referring folks to you and our other OB doctors referring patients to you, how can patients directly contact you if they think they might need some help?
Okay. Yep. Definitely. The OB department has been great about setting up those referrals. Primary care physicians can also send the referrals to our program. But I know that we're in the works of getting some education materials sent out to patients at their very first prenatal appointment. So it will have, information about our Ways to Wellness program, how they can contact us. And we've been working, this team that's been working, getting this whole thing rolling is not just from the clinic aspect, but it's from the hospital aspect too. So when moms are leaving home with baby, they're going home with again more information about this program. And so family members, sometimes moms don't even realize that they're, struggling, but a dad or a parent, might notice, and they can always reach out and call directly to get something scheduled. And we're also adding it into our prenatal classes, just more about our information. So
that sounds really nice. Yeah. Are you the exclusive OB Ways to Wellness person, Julie, or how does that work? Or does Christine have any part in that? Or
So since this is fairly new, a lot of times Christine will get referrals. If she can see them, she'll see them, but most of the time she sends them my way, just so that they're in a comfortable setting. You know, they're still going to the OB department. They're meeting with me right there. I've got an office right there. But there are 3 of us on the whole Ways to Wellness team. So there's myself, Christine Romsberg, and then Lakin Waldschmidt is our newest team member. And so we can all help. You know, there's a variety of us.
Yeah, I think you're all pretty busy. I mean, there's a lot of need throughout OB and non-OB related issues.
Mm-hmm.
Yeah.
Yeah.
Okay. So just can you give, for the folks listening and people that might share this broadcast, what ideas do you have for steps OB patients, what women can do who are pregnant to improve their mental wellness?
Yeah. I always encourage patients to reach out and lean on their natural support. So that's their friends, their family. If you're involved with church, you know, reaching out to things like that, looking at online support services, going to your provider. You know, if you feel like you're not right, or you don't feel like yourself or not how you want to feel, reach out to your provider, whether it's your OB or your primary doctor, and they can definitely help you and get you connected with us. I also say, make sure you find time for you, and that's your self-care. So read a book, go for a walk, get some sunshine, talk to a friend, just find that time for yourself. And the one thing that I probably say more than anything is it's okay to not be okay. And the big step is to reach out and ask for help when you're not okay, because there are lots of supports out there that you may not be aware of. So just know you're not alone, and there's lots of people there that can help you and supports around.
Yeah, that's great. This is a little off script, but I was just wondering about this. I've read, at least for teenagers, and I know a lot of the ladies that are pregnant are not teenagers, but what are your recommendations with folks in terms of, and I know we're on Facebook Live now, guys, so, but what are your recommendations for folks who are maybe having some mental health issues in terms of their social media? Do you get that specific with them in terms of what's helpful in terms of social media and what's not?
I haven't really seen a big thing. I know that I show a lot of people resources that they can use on YouTube. There's a lot of different resources that I will show people through that.
Okay.
And as far as like teens too, I do know that in the works is a teen support group that they're going to start up with our Ways to Wellness program as well. And as far as like online support groups, there are like different Facebook pages. I know a big thing that we've also discussed within our team of getting this rolling is sometimes there's not always like positive outcomes, you know, that come from, you know, you think you're having a healthy baby, and it doesn't always happen that way.
Yeah.
So there are like different online support groups and Facebook groups that are out there, and it's nice to be connected with people who are dealing with similar issues.
Okay. Yeah, good. Well, that's good to hear that those things are available to folks. I think the thing I think about is that sometimes on social platforms, everybody's life is perfect when you look at their. You mentioned like that for moms to know that there's a lot of people who are having similar issues. So it's good that you're pointing them to areas within the internet where they can see that, yeah, there are people like me who are working through these kind of issues. That's good. Yeah. Good. Hey, Laurie, let's get you back in here too. There she is.
Here I am.
So, hey, I've kind of gone through the questions that I have. Anything else that the two of you would want to add before we kind of sign off for the week?
Well, myself, I just like to tell people, you know, like I said, I want to end with, it's okay to not be okay. Just make sure that you're reaching out for the help if you feel like you need it, or if you see a family member struggling, you know, and just talking about people that aren't just OB moms, just anybody that you see struggling, you know, get them the help that they may need, that they may not know that they have. So it's okay to not be okay, but reach out for help when you need it.
Yeah. Appreciate that. Appreciate your comments, Sue. Thank you. Okay, Laurie, anything else you wanted to add?
I was just going to say, I just always want my patients to know that they're not alone and that they have, we're here for them. They have resources. All they have to do is reach out to us. And I do also focus in on the dads and say, you're there watching it. It's very hard sometimes when you're that person struggling to realize that you're struggling, and somebody that lives with you can sometimes see that first. So I remind them to reach out as well.
Yeah, great thoughts, and thank you for your comments, Donna. By the way, appreciate those. Okay, well, Julie, Laurie, great to have you. Thank you. I think it's been good, and I this information is really the kind of stuff we want to get. Thanks, Kimberly, I appreciate it. This is really the kind of stuff we want to get out to our community. For those of you who are watching, please share this with others that you know who might be interested, because I think this is the kind of stuff that's really helpful to help our community be healthier. So, ladies, thank you so much. Everyone, thank you for listening, and we'll catch up with you next week.